The Journey.
Our journey began more than 375 years ago when our founders Vincent de Paul, a country priest, and Louise de Marillac, a widow, pioneered access to health care for the poor and vulnerable in the streets of 17th century Paris.
175 years later, across the Atlantic in 1809, Elizabeth Seton, a widow and mother of 5 children, embodied the pioneer spirit when she formed America's first religious community of women in Emmitsburg, Maryland. This new community was known as the Daughters of Charity.
By 1852, 7 Daughters of Charity set out from Emmitsburg to introduce health care and social services to the Wild West. Their treacherous journey took them through the Isthmus of Panama, where Sister Honorine Goodman and Sister Mary Ignatia Green died of cholera. Pounded by heavy rains, tropical heat, and muddy mountain trails, the daring daughters continued traveling by train, boat, and mule to California. The 5 remaining daughters sailed on the steamer Golden Gate into San Francisco Bay on August 18, 1852.
More than 160 years later, on January 1, 2002, another group of pioneers formed Daughters of Charity Health System. Following in our founders' footsteps, they created local health ministries where quality, compassionate care is never compromised. Blessed with a pioneering spirit and guided by our Vincentian values, we exist to serve.
Established by the Daughters in 1858, the Los Angeles County Hospital was the first medical facility in the Pueblo of Los Angeles. Today, nationally recognized St. Vincent Medical Center ranks among the best in LA. Situated among apricot trees and agricultural fields of Santa Clara Valley, O'Connor Hospital began as the San Jose Sanitarium and Home in 1889 as the first hospital to serve San Jose's earliest settlers.
A few years later in San Francisco, the Daughters founded Mary's Help Hospital. Earthquakes in 1906 and 1957 devastated its buildings, but not the desire to serve. When Mary's Help Hospital was rebuilt in Daly City, it was renamed Seton Medical Center, honoring St. Elizabeth Ann Seton, our first American-born saint and patroness of our health system.
St. Catherine Hospital in Moss Beach was acquired by the Daughters and renamed Seton Coastside to care for coastal community members.
St. Francis Medical Center in Linwood was established in 1945 and operates the largest and busiest private emergency trauma center in Los Angeles County.
The hospital has remained a beacon of hope throughout historic riots and earthquakes, while welcoming thousands of new lives each year.
St. Louis Regional Hospital opened in 1989 in Morgan Hill. The hospital relocated to Gilroy and serves the fast-growing South County, showing what it means to be their neighbor for life.
Together, we are Daughters of Charity Health System.
Together, our physicians, associates, volunteers, and Daughters of Charity partner with members of our communities to bring our mission of healing to all.
Together, we give voice to the voiceless and are grateful to serve those in need.
Together, we follow in the footsteps of our pioneer companions who carried our mission forward in times of hardship, challenges, and doubt. Together, we persevere. For we too
are pioneers.